Images of war, especially in Iraq and Afghanistan, have brought the realities of war into our daily lives. These images include injured servicemen and women, many with limb loss. The 2013 Boston Marathon bomb blast brought it even closer to home, injuring 262 people, 16 of them suffering limb loss. What does it take to give limb loss victims a chance to regain their lives? Advances have been made with sophisticated new artificial limbs and specialized bracing that allows restored mobility. But how much does it cost? Is this modern technology a realistic option? Or are costs so excessive that it's out of reach for average Americans with typical health insurance plans? A new study commissioned by the Amputee Coalition, conducted by the renowned research team at Dobson DaVanzo, and funded by the American Orthotic and Prosthetic Association, examined every Medicare expense over a 4-year time period. It concludes that these new technologies are not only cost-effective for the average patient, but that in fact, mobility saves lives and money. The study examined 2 groups of patients. One had timely clinical intervention, receiving a needed limb or a brace. The other group did not. As a society, we already know that keeping people active and mobile is one of the best ways to provide a quality of life where people can be independent and in control of their own destiny. That's something we can all support. After all, it's doing the right thing. The analysis proved conclusively that providing needed limbs and bracing restores mobility, and confirmed that mobility saves lives and money. Immobile patients have more indications of comorbid conditions, obesity, hypertension, and depression that trigger even higher total health costs. Their total costs outpace those who receive treatment and who have greatly improved mobility and independence. Report author Dr. Alan Dobson, former research director of the Medicare program, said, "Looking at all the costs and other outcomes, including use of outpatient therapy, number of falls, ER admissions, and acute hospitalizations over a 12 to 18-month time period, our study concludes that patients who received the bracing and artificial limb services experienced greater independence than patients who did not, with better or comparable health outcomes and generally lower Medicare payments." Susan Stout, interim president and CEO of the Amputee Coalition, said, "Every person who has suffered limb loss and who has received a prosthetic device appropriate for their needs knows the value of the device for them personally. This study provides nationwide data which helps to corroborate this patient experience and also points us to the need for more research regarding the value of prosthetics from both a quality of life and a financial perspective." Out of chaos and mayhem in Iraq and Afghanistan has come much of the innovation that we see around us today, proving good can come out of tragedy. This study shows we can afford to provide servicemen and women and our elderly citizens alike with the technology and care that not only save their lives, but helps them regain their independence at a lower cost. That is healthcare reform everyone can sign up to.